life stress. So that's where, not having enough money, feeling not having a secure home situation. So these different chronic life stresses. Lack of support. So social support, that could be lack of support from the partner, lack of having friends around with young children to talk to, so the peers of having someone with another baby to, bounce ideas about or to normalize the mothering experience. Marital dissatisfaction, so that goes along with the marital conflict. Low self-esteem, low socioeconomic status. When we say marital status, we're talking about being a single mother. That's a risk factor for developing postpartum depression. And you'll see that many of these variables are probably interrelated, right? Often correlated with each other, because moms who are single probably also have maybe some low self-esteem, low socioeconomic status, and maybe not have a very strong support network. So you can see that it's a cyclic environmental component, or an unwanted, unplanned pregnancy. So these are the common risk factors. But you can see that this research, this meta-analysis, was conducted in 2001. There's more recent risk factors that are consistently coming out in the literature, and one of them being a recent immigrant mother. These moms are 5 times more likely to develop postpartum depression. And we're not 100% sure why they are, but right now I'm conducting a study. It's called New Mothers in a New Country. Some of you may have heard of it, where we're recruiting over 500 Chinese mothers from the community. Half of them are recent immigrants. We've defined that as they've moved to Canada less than 5 years ago. And then half of them are Canadian-born moms, where they were actually moved here before the age of 5, or they were born here. And then what we're doing is we're following these mothers to 1 year postpartum, and we're looking at their levels of acculturation, acculturative stress, all these different factors, the practicing traditional postpartum rituals, how they're integrating into the communities. And so we're looking at what places mothers at risk for postpartum depression. And we're controlling for the Chinese culture, because the control group are Canadian-born moms who have a Chinese heritage. So we're trying to control for culture, and we're looking at the immigrant experience. And what about it makes the moms at risk? So that's a study. We're just finishing recruitment. We have over 550 mothers, and that study should be done in about a year, and I'll be able to come back and present those results. Okay. But we're looking at other unique risk factors. And as I said, a mother with a history of trauma, any type of trauma, either current interpersonal violence or childhood trauma, places a mom at risk. So that's a new risk factor that doesn't come up in these meta-analyses, because we weren't really looking for those risk factors, but we now have shown very detailed associations in the literature. Unfortunately, postpartum depression occurs at a time when the infant is maximally dependent on parental care and highly sensitive to the quality of the interaction that they have with that primary caregiver. And so consequently, we see postpartum depression impacting parenting behavioral, just their behaviors in general in relation to health promotion. So we see mothers with significant postpartum depression, they're less likely than non-depressed mothers to breastfeed their babies, and I'll talk a little bit more about this later. They're less likely to attend well child visits. They're less likely to have their child immunized, to use home safety devices. They're less likely to put their baby to sleep on the back, and they're less likely to use car seats correctly. So these are, I call, health-promoting types of behaviors. We also see consequences on the child's developmental trajectories. And we think that the risk transmission is through an altered maternal-child interaction. We think that that's the underlying mechanism related to this. And when we talk about developmental trajectories, we're looking at cognitive development, behavioral development, and emotional development. So postpartum depression impacts these types of developmental outcomes. So let's first talk about child developmental consequences. The literature around this is very well established. The general consensus is that postpartum depression predicts poor language development and IQ development in children, and that this impact early in the postpartum period continues into adolescence. It's really interesting how you can follow these children and they're no longer exposed to a depressed parent, and it will continue into adolescence. The impact is greater on little boys We're not 100% sure why, but little boys are impacted more so than little girls. And of course, in relation to any of these consequences, it's about the exposure, the amount of exposure to the depressed parent. So if the depressed parent is not the primary caregiver, if someone else is the primary caregiver, then the impact on the child will be less. But if we see that the depression is recurring over and over and over, then this child is at increased risk for these poor developmental trajectories because it's increased exposure to the depressed parent. How does maternal-child interaction difficulties affect cognitive development? We think that there's 4 underlying mechanisms that lead to this outcome. So a general reduced responsiveness, I'll talk about these in detail. Lack of contingency and learning, modulation of input to sustain attention and scaffolding, and reduced and less responsive book sharing. So what do I mean by this? So this reduced general responsiveness is without stimulation and responsiveness, the infant withdraws from the environment. So the infant is sitting there and the environment is around them. And when you provide them with a stimulating environment, they're learning from their environment. And so we know that children that have a stimulating, engaging environment have higher IQs. Contingency, by experiencing their parents' consistent and predictable responses to their own behavior, teaches them that when this happens, this is the response. So it teaches them basic cognitive skills between stimuli and responses. So they're learning that if this happens, if you do something, you get this response. And they're learning that pattern. And that pattern is repeated everywhere in the world, in their experiences with toys, with other human beings, with little peers, with parents. So they're learning this stimuli response pattern, and that's important for cognitive development. Attention and regulation and scaffolding. When parents present objects to their children, they stimulate sustained attention. For children to learn, they need to be able to have sustained attention and to be able to focus on something, right? That's why we want to engage them with a toy and have them continue to stay focused on that toy and to play with that toy. So the sustained attention. And with the sustained attention, we want to have scaffolding, which means that we build upon skill sets, little tiny developments. So this toy will build upon this toy, will build upon this toy, so that they're slowly learning a more detailed, complex behaviors through the play and through interactions that we have with them. That's called scaffolding. Scaffolding is very important for child development. And then we have book sharing. First of all, book sharing supports attention and focusing. So these children learn to sit there and they learn to focus and pay attention. So that's one of the important components of book sharing, but it's also a very important language acquisition device. 3/4 of all labeling of certain objects in the world is through book sharing. So we read a book to a child, we say, this is a ball, the dog, there's a dog, oh look, the dog is chasing the ball. So they learn labeling, they learn sentence structures, they learn language. And of course, that's where the language ability helps with the cognitive development. So that's the different mechanisms that we think underpin cognitive development. And with impaired maternal interactions, these mothers provide a less stimulating home environment. They're less likely to read to their children, to provide scaffolding moments, and to provide opportunities for sustained attention. Not saying all depressed mothers do this, but this is an increased likelihood. If they're depressed, they're less likely to engage in these types of activities with their children. And then we have behavioral consequences. A meta-analysis of 193 studies, this is 193 studies where we pooled all the different studies, showed a significant association between maternal depression and behavioral outcomes. And when we talk about behavioral outcomes, there's 3 different types of outcomes that we're referring to: internalizing behaviors, externalizing behaviors, and temperament. That's the emotionality. And so when we talk about internalizing behaviors, we're talking about children who direct their feelings inwardly. And so what you see is withdrawn behavior, we're seeing depression, eating disorders, and increased likelihood to engage in substance abuse activities. For externalizing behaviors, we're talking about directing their behaviors outwardly, and so we're seeing more delinquent, aggressive types of behavior and more hyperactive activities. So when a mother is experiencing postpartum depression, or depression that is chronic and reoccurring, what we see is an increased likelihood for internalizing, externalizing behaviors and a more difficult temperament. Now, we don't know about the temperament because we know that there's a relationship between temperament and maternal depression. But we don't know if the child who's really difficult can increase the mother's likelihood to experience depression, because they're less likely to be able to sleep, take care of themselves, have self-care activities. So these are all associations. These are not causal pathways, right? What I'm talking about here are associations. And if a mother is experiencing postpartum depression, it increases the likelihood of having these outcomes, but it doesn't mean that for sure the child will have these outcomes. And what's most important is about how much exposure this child has to a depressed parent. Okay, so I don't want to be an alarmist here by saying, oh, all these terrible things will happen. I really want to frame this to say that these are potential outcomes that a child may experience, and why we need to really focus on postpartum depression. And how does maternal-child interaction difficulties affect these behavioral outcomes? We think it's about the parents not being responsive to the infant's recovery to distress. So when a child is distressed, how do you respond to that child and help them recover from the depressive episode? There's particular strategies that need to be in place to help the child to recover. So we think that parents who are depressed, they're less likely to engage and assist the child to recover from these distressing situations. And we know that parents who are depressed tend to interact with the child in more of a hostile or an intrusive manner, and that impacts these behavioral outcomes. And when we talk about emotional consequences, we're really talking about infant attachment. So it's the maternal infant attachment, that environment that the child is living in with the primary caregiver, which is typically the mother.